Good morning, and thank you to everyone for taking the time to focus on what matters, keeping people on Medi-Cal and not letting the Trump administration win. I have a first rule of government, and the first rule of government is you don't let people die. And we're already seeing the effects of H.R. 1 across the state. The rate of successful automatic renewals has been cut in half since the flexibility was turned off last June by the federal government. That means children and family lost their coverage. Californians should be able to do normal things, like take their kids in to checkups and get medical services that would prevent ER visits. As a state, we need to prioritize this in our budget. My bill, AB 2201, will aid in this fight by reducing the burden on Medi-Cal recipients and county workers by removing administrative barriers for those experiencing the most immediate and devastating impacts imposed by Trump's H.R. 1. The priority should not only focus on legislation, which is important, but also on our state budget, which must prioritize keeping people on Medi-Cal. We know that when we prioritize funding for Medi-Cal services, we're not only prioritizing people's health, but the state budget as a whole. With that being said, my colleagues and I have introduced legislation to protect Californians who are counting on Medi-Cal to keep their families healthy. AB 2208 by Assemblymember Stephanie, who could not be here today, will help reduce barriers to care by preserving retroactive Medi-Cal coverage, lowering costs for low-income patients, and improving access to eligibility information. Healthcare should be accessible, affordable, and available to every Californian who needs it. Our response to Trump's H.R. 1 is clear. Protect families, not cuts. Next, I'd like to introduce a couple of my colleagues. My name is Assemblymember Boerner. A couple of my colleagues who are with me here today to talk on how do we protect health care coverage and protect Californians. So with me, I'd like to introduce next Senator Lola Smallwood Cuevas.
Good morning, everyone, and I want to thank our good Assembly member, Tasha Boerner, for this important gathering today and bringing us all together for this important issue. I'm Senator Lola Smallwood Cuevas, and I represent the mighty 28th District in South Central Los Angeles, the most diverse district in California. And I'm here today because I know what it means to work hard and to still not have ends meet. I see and hear from constituents every day in my district who are facing that challenge, and now that challenge has gotten that much worse as we're looking at Trump's maniacal decision to take $4 trillion out of our economy, give it to the top 1% of this country, and leave millions of Californians as a result without adequate health care. Because of Trump's backed federal cuts under H.R. 1, California is now facing a projected $1.8 billion budget shortfall, and we know who will be asked to pay the price. Immigrants, working families, seniors, communities already struggling to get by. And let me be clear, our Black and immigrant communities are not the problem. They are essential to the strength and success of our state. The real problem is an economy where millions of people work full-time and still cannot have the basic necessities such as health care and health care access. These are our community members who do essential work every day, yet many still have to rely on Medi-Cal, our state safety net, for health care because their employers do not provide affordable health coverage, all while billion-dollar corporations make record profits. This is wrong. Californians, whether on the left and blue side of the aisle or right side of the aisle, agree that it's time for all Californians to pay their fair share. And Californians deserve accountability, and that's why I have authored SB 1284. This bill is simple. If a large corporation is shifting their health benefits, the cost onto taxpayers through Medi-Cal, the public deserves to know. Because transparency creates accountability, and accountability creates change. I'm also proudly supporting SB 12012 on behalf of Senator Akilah Weber Pearson, who could not be here today. This bill helps track the impact of H.R. 1 on Medi-Cal and strengthens outreach so families do not lose coverage unnecessarily. Our communities cannot afford more cuts that hurt working people. And our communities, particularly the taxpayers, as they are looking to make ends meet, to try to make their dollars go further, should not have to carry the burden of paying employer health care premiums, particularly the world's wealthiest employers. This is not fairness, and that is why we are moving bills like SB 1284 and SB 1202 to ensure that fairness comes and relief comes to the California taxpayer. Our communities cannot afford more cuts and more hurt. Thank you very much. And next, I will introduce, who is next on the list? Senator Maria Elena Durazo, my partner in good trouble.
Yes, we love good trouble. Thank you, and thank you, Assemblymember Boerner and all of my colleagues here. I want to start with a simple truth. Healthcare is a human right for everyone, not for some, not everyone, for everyone. It is not a privilege based on where you were born or how much you make. That is why I fought alongside the Health for All movement to make California the first state in the nation to expand Medi-Cal to all uninsured Californians. That decision drove California's uninsured rate to a historic low of approximately 6%. But last year's freeze is rolling back that progress. The state has created a two-tier healthcare system where your immigration status determines your right to be healthy. And we must be honest about what this freeze actually does. It doesn't save money. It shifts costs. When people lose access to primary care, they don't stop getting sick. They wait until they can't wait any longer and end up in the emergency room costing 12 times the normal rate. This is not cutting costs. This is costing lives. And the financial burden lands on our counties and our hospitals already facing enormous pressure from federal cuts. We're also cutting care in the middle of a moment of deep fear as immigration raids are terrorizing our communities. Families are afraid to leave their homes, let alone go to the doctor's office. The people we are turning away from the system are the same people already being pushed to the margins. We cannot push them off the edge. Let me be clear, we cut health care from the people who literally put food on our tables. They build our homes and help to power our economy. They contribute almost $10 billion in taxes every year. Without our undocumented neighbors, California stands to lose billions, hundreds of billions in GDP. They are asking us to be included in the very system that they pay into. I urge every member of the legislature, the governor, and everyone with us, stand with us to pass SB 1422 because every Californian, I repeat, every Californian should have access to the health care that they need and deserve. And next, you can do it?
Yep,
Okay.
yep, I'm gonna step in.
Sorry, I don't want to take your...
No problem. I inadvertently didn't see one of our fierce health champions, the chair of our health committee, my colleague, Assemblymember Mia Bonta. Thank you so much. Good morning. I am Assemblymember Mia Bonta, and I represent the beautiful people of Oakland, Alameda, and Emeryville in Assembly District 18, and I'm honored to be able to serve as the chair of Assembly Health this year. We are here today because when Donald Trump signed H.R. 1 into law, he threw Californians' health care infrastructure into absolute chaos, and California must respond with the courage for health for our constituents. I'm so grateful that my colleague, Assemblymember Tasha Boerner, has been so clear-eyed about how this problem will impact her constituents and ours collectively, and I'm lucky to have her in our corner in this fight. I want to dive into just one thing that H.R. 1 imposes: disproven work requirements. These requirements are not designed to help people find jobs. They are not designed to do anything but create bureaucratic hurdles that push people off their insurance, and even when they're working, even when they qualify, even when they are doing everything right. We've seen this before.
Arkansas implemented Medicaid work requirements in 2018. Within 7 months, 18,000 people lost their coverage, not because they stopped working, but because they couldn't navigate the paperwork. Research has repeatedly linked these requirements not to increased employment, but to loss of care. They know they are imposing these requirements because on people already working or exempted because they are hoping they fail their paperwork test and get kicked off in the process. Imagine a test that there is no way for you to actually get an A on. And it's already starting. Nebraska launched work requirements this week, 8 months ahead of the federal deadline. Experts are already warning that tens of thousands of eligible people in Nebraska will lose coverage due to the documentation burdens and inadequate notice. The Urban Institute projects between 3 and 7 million people nationally will lose Medicaid coverage by 2028 because Donald Trump signed into law a system designed to trip people up and kick them while they are down. Our own Department of Healthcare Services estimates 1.4 million Californians who are on Medi-Cal will lose their coverage. That is what the bigwigs in Washington want, and it is why we are standing here today. That is why I introduced AB 2161, and proudly am a co-author of Assemblymember Boerner's bill. My bill limits California's implementation to only what federal law requires and not an inch further, because heartbreakingly, California's proposed budget is set to go even further, applying these requirements to state-funded populations where no federal mandate exists. That is a choice. That is a choice that California is making. That is a wrong choice, and it's one our constituents cannot afford us to take. AB 2161 directs the state to use data it is already has to verify compliance automatically rather than forcing individuals to file paperwork the state can look up itself. We need to do our homework. This is critical for the Californians already juggling raising kids, making ends meet, who otherwise will be stripped of coverage due to Trump's bureaucracy. We don't need to adopt that bureaucracy. We can do better here in the state of California. It also ensures that 20,000 humanitarian immigrants, asylees, and refugees are not stripped of their coverage when no federal law requires it. California made a commitment to health for all. The champions that are here today made a commitment and fought to make sure that California could have health for all. That is a legacy. I know here, now, we have an interest in preserving because we cannot walk that back. Because when we fight together, we win. And we are going to fight. Thank you.
I think maybe Assemblymember Boerner should have gone first. And with that, I will now introduce my dear colleague, Patrick Arentz, who's also carrying a bill in this package. And if you heard him on the floor yesterday, you would hear how he himself experiences great compassion for others because of his experience. And thank you for being here with us, Patrick. Please.
Good morning. Thank you. I, first of all, just want to say how appreciative I am of Assemblymember Boerner's leadership in this area. For me, this issue is very personal. I was a child that did not have access to health care services, and if it wasn't for the Medi-Cal program, I would not be able to have health care at all for the sporadic moments that I did. And we talk a lot in Sacramento about how our budget is our values, and we've been talking a lot, certainly since I've gotten here about a year and a half ago, around how devastating the cuts to our healthcare system is. And we need to be very, very clear, not only with our constituents and the people of California, but with our elected colleagues and leaders in the state Senate and with the governor about what it is we can protect and what are our red lines. And, you know, this issue is very personal to me And I also want to uplift and appreciate how much leadership Assemblymember Boerner has led on this issue, where she led a delegation throughout the state of California for the past several months, meeting with public officials, meeting with people in Los Angeles and in Northern California and in Silicon Valley in my district, where she hosted us for a deep conversation regarding our public hospital system and our public health care system in Silicon Valley, and how we talked about how so many families, this is a lifeline for them, and how the cuts of H.R. 1 are going to impact their livelihoods. I am the first person to be born at our county hospital, to serve in the legislature, and so this issue, these stories are my story, and that is what I was elected to do, is to not just tell stories of my constituents and myself and how I grew up, but to fight. And as I have said before, and as Assemblymember Boerner and Boerner have led on, this is not a fight that we asked for, but it is a fight that we intend to win in the legislature, because we can't afford to lose. And certainly our constituents can't, who are relying on this to stay alive. This is not a luxury. We are not talking about extra coverage for benefits or things that are nice to have, or what the Republicans in Washington, D.C. are disagreeing with us on. This is about people's livelihoods, and we need to be very clear-eyed in the legislature that if they come after our most vulnerable people in California, that someone has to stand up for them. And that is what my colleagues are doing, and I am proud to join them in this effort. But we must be very clear, as someone who is still a year and a half in, what I'm fighting for up here. And I'm fighting for our constituents who are literally being attacked by the federal government. But we cannot just be about being against someone. We have to be for something. And these bills represent what we are for. And this is our message, and I'm proud to stand with my colleagues to support and uplift their work on that, and join them in the arena as we fight for Californians when the federal government doesn't. Thank you so much.
So well said. And with that, I think I have, unless I messed up, my last Assembly colleague, Lachey Sharp-Collins, who is just a giant, punches beyond her weight, and she's amazing. So with that, Assemblymember Sharp-Collins from San Diego.
Good morning, everyone. Thank you, Assemblymember Boerner, for inviting me to be a part of this hard-fought conversation. And it's an honor to stand before you with all of my colleagues here as well, and members of our community, as we stand up to what's happening right now in this day. I am Assemblymember Dr. Lachey Sharp-Collins, as she said, coming out of San Diego. I'm also the Assistant Majority Leader over Policy and Research, and being able to be over the Policy and Research Division has allowed me to step further into the affordability conversation, to step further into how we're going to address this issue pertaining to H.R. 1, also serving on Budget Sub 2, doing everything we can to protect these safety these social safety networks. But we are here today because H.R. 1 is not just another budgetary conversation. It is a direct attack on working people. It's a direct attack on poor people, seniors, children, and communities that already struggle to access health care in the wealthiest nation in this world. I see it every day in San Diego. While billionaires and corporations continue to generate record profits and receive huge tax breaks, Congress is proposing nearly $1 trillion in cuts to Medicaid. This is the largest cut in program's history. So let's just call it what it is. We're going to call it a selfish, evil political choice. They are choosing to strip health care away from millions of people to benefit the wealthy and the powerful. In California, the damage will be catastrophic. We were talking about this a lot. Do we really have the money to handle this? This is a strong, big reality. The Department of Health Care Services estimates that up to 1.8 million Californians could lose Medi-Cal coverage because of H.R. 1. That was already stated by one of my colleagues. But in my district, nearly 94,000 residents, almost 20% of my district is expected to lose care. Not because they are underserved, not because they're not working hard enough, but because politicians in Washington, in an effort to benefit the wealthiest Americans, are purposely creating more bureaucracy, more paperwork, and more barriers designed to push people off of their health care coverage. These new 6-month eligibility checks and burdensome reporting requirements are not about accountability. They are about exclusion. They are about making it harder for single mothers, for caregivers, for seniors, for Californians with disabilities and working families to actually survive. But we continue to talk about survival, but we have to remember people should not just be surviving, they should be thriving. People will lose coverage simply because they miss paperwork deadlines, because they cannot access documents or cannot navigate a system intentionally that is made to be more complicated, as was already previously stated, to get you to fail the test, to get you to not get an A. And while the federal government walks away from its responsibility, counties like mine are left to pick up the pieces. My county is legally required to care for residents regardless of their insurance status. That means overcrowded hospitals, overwhelmed clinics, burned out healthcare workers, and devastating budget shortfalls. San Diego County alone is facing a projected $29 million loss in fiscal year 2026, with another $150 million in the potential cost the following year. These cuts will not only hurt those on Medi-Cal, they will hurt every single community. When hospitals close services and when clinics cut off staff, when emergency rooms are overcrowded, every single person pays the price. When I think about some of the meetings that I've been on and my staff have been on, there's already record numbers of people already dying. There is no community that would be untouched by this attack on public health care. Do we believe health care is a human right? You better. Or do we believe only that the wealthy deserve to live healthy and dignified lives? All of our lives matter. I refuse to accept a future where children lose access to doctors so corporations can't protect their benefits. I refuse to accept a system where survival depends on wealth. And I refuse to stay silent while politicians gamble with the lives of million Californians. You're going to stop gambling with my life. I need you to stop gambling with my constituents' lives. Everybody's lives matter. Fighting for California is what we are here to do. That's what I was elected to do. That's what my colleagues behind me were elected to do. And fighting against these H.R. 1 cuts is fighting for California. It is what we need to preserve health care as we know it, and therefore preserving access to life-saving treatments. You know, they always say people are sick and tired of being sick and tired. We are all sick and tired of being sick and tired. This should not be a yearly conversation. Everyone deserves the right to have quality health care and equal access to that. And that's what myself and my colleagues and those around us are going to continue to do. As it was stated, when we fight, we win, and I guarantee you we will win this battle. Thank you.
Nancy, you have the pleasure of going after Assemblymember Sharp Collins. I want to invite up Nancy Netherland, Senior Specialist, Family Voices, California.
Good morning. My name is Nancy Netherland. I'm the single parent of 2 children with significant special health needs who rely on Medi-Cal every day. I also work statewide with other families through Family Voices of California. For families like mine, Medi-Cal is not abstract policy. It's therapies, medications, durable medical equipment, specialists, behavioral health care, in-home supports, and wraparound services that allow children like mine with complex health care needs to remain safely at home and in their communities. Families caring for medically complex children are already navigating enormous administrative burdens. My youngest daughter, a former foster child, relies on 27 medical specialists, 3 pharmacies, IHSS, regional center services, and behavioral supports through Medi-Cal. We spend countless hours coordinating appointments, therapies, medications, school supports, and services. I'm currently more than 50 hours and 2 lawyers into trying to secure appropriate post-high school independent living supports for her. My children may technically qualify for exemptions for proposed work requirements, but exemptions and waivers are not automatic. Adding more paperwork requirements, more frequent eligibility checks, or work reporting requirements will not make the system more efficient. These policies increase the risk that eligible children, parents, and caregivers will lose coverage simply because the system is too burdensome to navigate. And when coverage is interrupted, the harm is immediate. Last fall, an administrative coding error meant my daughter temporarily lost access to critical medication and became too sick to leave her bed. Too sick to attend school, too sick to participate in daily life for months. Families caring for children with complex needs should not have to become full-time paperwork experts just to maintain health coverage. That's why these bills matter. They help reduce harmful administrative burdens, streamline renewals, protect affordability and access to care, and improve outreach so that eligible families do not lose Medi-Cal coverage because of paperwork barriers or system confusion. While these bills may sound administrative, let me assure you they're anything but. They mean the difference between a teenager getting the support she needs to graduate from high school, as my daughter will in 2 weeks, or losing access to the care that keeps her healthy enough to leave her bed, attend school, participate in the community. I urge support for these bills to reduce avoidable coverage loss, minimize administrative barriers, and protect continuity of care for California families. And thank you to the senators and assembly members who made this possible. Thanks.
Thank you, Nancy. And now I'd like to invite up Dr. Sacia. Yeah, there we go. Aquino, Executive Director, Latino Coalition for Healthy California. Thank you.
Muy buenos días, and thank you for joining us this morning. Dr. Ceci Aquino, Executive Director of the Latino Coalition for a Healthy California. We are here today because we recognize the urgent need to protect Medi-Cal coverage for all Californians. The cuts to health coverage at both the state and federal levels threaten the progress we have made to ensure every Californian, regardless of immigration status, can access the care they need. Since the end of the pandemic, we have seen how confusing administrative barriers lead to mass disenrollments. Instead of making it easier for low-income families to enroll in and keep Medi-Cal coverage, policies are making it harder. And now, this anti-immigrant federal administration is imposing even greater barriers that will make it even more difficult for Californians to stay covered. Make no mistake, work requirements and more frequent renewals will increase disenrollments. This will especially harm Latina communities. More than half of all Medi-Cal recipients are Latine. During the Medi-Cal unwinding period after the pandemic, the majority of disenrollments were among Latina individuals and families. In 2025 alone, more than 700,000 Latinos lost Medi-Cal coverage, and that was without work requirements and while renewals were only annual. Now families are facing an enrollment freeze, work requirements, twice-a-year renewals, and a growing fear around deportation and immigration enforcement. Together, these pressures will push even more people out of coverage. Our promotoras de salud are already hearing from community members who are worried about how they will prove that they work. This is especially true for undocumented workers, many of whom work every day despite the fear of raids and deportation, but may have no formal way to document their income. But we are here with solutions. At LCHC, we are proud to partner with our legislative leaders here and partners to advance this Medi-Cal protection package. AB 2201 would reduce administrative burdens and simplify the renewal process, making it easier for families to keep their Medi-Cal coverage during an already difficult time. And SB 1422 will restore access to all Californians. By restoring access and critical pandemic-era Medi-Cal flexibilities, AB 2201 and SB 1422 will help protect the health of all Californians and recognize that the health of our most vulnerable communities affects us all. Thank you.
Thank you, Dr. Aquino. Now I'll invite up Alexis Robles-Frade, Policy Analyst, National Health Law Program. Thank you. We'll switch out. Thank you. There we go.
It's a great sign. Hello, my name is Alexis Robles Ferday, and I am a policy analyst at the National Health Law Program. We're proud co-sponsors of these bills, and I'm here to talk about what's at stake. First, work requirements are punitive and simply don't work. Work requirements do not increase employment or improve economic conditions. Instead, work requirements make applicants and Medi-Cal members meet burdensome and confusing new requirements that deny them coverage and access to the health care they need. They have also been proven to not work in the handful of states that have applied them up to now, while costing the states millions of dollars to implement. In addition, H.R. 1 will increase Medi-Cal terminations due to 6-month renewal requirements that increase the burden placed on members to provide documents or information, and not because these members aren't eligible. H.R. 1 cuts health care from those who need it in order to fund the federal government's tax cuts for the wealthy and a tax on our marginalized communities. Members may lose coverage due to no fault of their own when mail is lost, county eligibility workers are overburdened, and information slips through the cracks. These bills aim to reduce the harmful impact that H.R. 1 creates by helping to ensure that Medi-Cal members are not buried by paperwork and administrative barriers to access the vital health care they need and are entitled to. By ensuring that people on Medi-Cal get the information they need to navigate these changes, and by limiting cost sharing for people in Medi-Cal and maintaining the 3-month retroactive period to get Medi-Cal for people experiencing medical debt. We know legal aid advocates in California are already seeing many cases involving medical debt, especially situations where someone is eligible for Medi-Cal but not enrolled, and experience a sudden health event like a car accident or a heart attack. These hospitalizations can leave people with tens of thousands of dollars in medical bills. H.R. 1 will only increase these debts without the protections that these bills provide. Collectively, these bills protect Medi-Cal coverage, access, and affordability for Californians by mitigating the harms of H.R. 1. And thank you so much to our senators and assembly members for having this event and sponsoring these bills.
Thank you. Thank you. Next, we have Whitney Francis, policy advocate, Western Center on Law and Poverty.
Good morning. My name is Whitney Francis, and I'm a policy advocate at the Western Center on Law and Poverty. We've heard powerful testimony this morning about why keeping people on Medi-Cal is so critical. Nancy earlier shared her story about the crushing administrative burden that H.R. 1 imposes on families caring for loved ones with complex medical needs on Medi-Cal. And she's not alone. Medi-Cal is one of California's strongest anti-poverty tools, providing essential health care for nearly 40% of the state's low-income working families. Yet H.R. 1 represents the largest funding cut in the history of the program. The impact of these harmful federal policies affects us all. When a parent loses Medi-Cal coverage, they skip their checkup and end up in the emergency room. When your grocery store clerk can't afford their medication, they miss work. When a clinic loses Medi-Cal patient, it closes. These are not abstract policy outcomes. They are our neighbors, our communities, and our local economies. That's why Western Center is proud to co-sponsor these 4 bills. And I want to thank Assemblymember Boerner, Assemblymember Bonta, Assemblymember Stephanie, and Senator Weber Pearson for their leadership. Supporting these bills is a vote for the health and economic security of our low-income residents and for all of us. As the 4th largest economy in the world, California has the power and the responsibility to protect its people. So the question I want to leave with you all today is, what kind of California are we building towards? One that gives in to the Trump administration's cruel cuts to fund tax breaks for the wealthy? Or one that meets the real needs of everyday Californians who are working hard but still struggling to afford food, housing, and medication? The answer should be clear. We urge every leader in this state to stand with us. The health and well-being of 14 million Californians is on the line. Thank you.
I am looking around Okay, I think all speakers have spoken. Assemblymember Mark Gonzalez wanted to join us, and I think he was prevented from joining us today, but maybe he'll sneak in at the end. I noticed Assemblymember Boerner snuck in and snuck out. I didn't see it. I don't know. I want to know how she does magic tricks, but it's part of her gift. I am so lucky to be standing with these amazing leaders behind me. We have this choice to protect California, to protect families, to protect the children and their future. And so with this package of bills, I'm happy to say the state legislature is standing with Californians. Thank you. Oh, we now are going to Q&A. Sorry, we're now going to Q&A. So if there's any questions, we can facilitate. Yes.
Question.
Sorry about that. Okay, no, we're good. We're good.
If you could clarify what is exactly being cut for these programs in the governor's budget, and what you want to fix, what you want him to fix is maybe revise this Thursday.
I think the best person to answer that question would have been Assemblymember Boerner, who's not here. So I think what we have to do is, when you look at the cuts that are being proposed in the governor's budget, those cuts are unacceptable. Because as Assemblymember Sharp Collins said, just because one is not affected by the eligibility doesn't mean the health systems can support the impact of it. So I would encourage us to look and see, how do we look at a wider lens of how we protect Californians, and that's our priority, not these cuts. And several of the bills do offer revenue sources for the budget in this case. But it is not just the people who are losing eligibility who will be hurt. They'll be hurt first. Second will be everybody else. When our hospitals are impacted, when you have a critical care case and you can't get into a hospital because the wait times are too long, because people aren't getting preventative care, every single Californian's at risk. And that is not who we are as Californians. Do any of you want to answer that question?
I mean, you did a pretty good job.
Okay. Okay. Any other questions? Boerner. It's okay.
It was mentioned too that wages and job losses would also be impacted. Is there anything else that would be impacted as well, as far as maybe closures of hospitals?
Yeah. Well, I think when we look at this, when people don't have Medi-Cal coverage, they're not going to the doctor, but they're going to still get sick. People get sick. People need coverage. People need health care. So they're just going to wait till it's really bad. And those costs are going to be high, and they will not be able to cover them. So then the hospitals won't get reimbursed. That's the danger, especially with public hospitals or county hospitals. So I think there's a cost area there. And the first part of your question was about hospital closures. It was. Can you remind me what the first?
Hospital closures.
Yeah.
Would they be affected too?
So I think they'll be affected, but also what's so counterintuitive about all of HR 1 is they're placing a very high administrative burden, growing government with the hope that states won't grow government to care. But the reality is California is not going to let our people die. We have proven time and time again, we step up where they step out. So when I think about what this is we need to help counties. There's many things we need to do. We need to prevent the cuts in the budget. We need to pass this package of bills. But we also need to make sure that our counties have the healthcare workers that go out there and are making sure every single person who's eligible for Medi-Cal is getting that Medi-Cal coverage. And we do, as exactly what Assemblymember Boerner said, we do the minimum to comply. We don't go over what the federal government's requiring, because that doesn't help California. That hurts Californians. Any other questions? Okay. Thank you so much for being here with us. All of the Assembly members and our sponsors are amazing advocates. And we'll be here for questions and individual interviews afterwards. Thank you for joining.